HIV does not spread with hugging or handshaking or sitting together. They can live normally with people. It only spreads through contact through body fluids.
In our community centers, I think the government is doing well enough for in tracking data, tracking cases, diagnosing new cases, keeping a track on viral load and CD4 counts and everything. The only thing lacking behind, I think, is the supply and resource allocation through drugs mainly. So the drugs, the TLD bottles that we get for monthly subscription of drugs into the through our AIT center, like that is lacking behind.
It's intense. Okay, when somebody is diagnosed with HIV, it is okay. It's a very scary situation. So many young boys, so many people come to us with new positive reports, and they are very, very scared. So let me tell you, it's not a death sentence. We do a couple of tests, we see your immunity levels, and we start you on treatment. And if you are very regular with your treatment, you're very you've gotten your CD4 checked, and every like for infections you're getting yourself screened, you can live an absolutely normal life.
Gotcha.
Yes, if the patient is regularly taking antiretroviral therapy, and if the patient is having all the precautions, the viral load is less, it is possible to have HIV negative baby, but for prophylaxis, we have to give the baby also the antiretroviral therapy after delivery.
Yes, an HIV positive mother can breastfeed a child. The rate of transmission of HIV from the mother to child through breastfeeding is very small. But this increases if the mother has any cracked nipples, or if she has injuries on the breast, or if a woman is giving multiple types of feeds, which means if she is giving breastfeeding along with top feeding, then the risk of transmission is higher, because in the intestine, because of different types of feeds, the intestinal activity, mucosal activity increases, and the chances of virus breaching the mucosa is higher. So if a woman is only breastfeeding her baby, even if she is HIV positive, the chances of transmission is much less. And if you were to counterbalance the cost of the top feeds and the cost of malnutrition resulting because of lack of breastfeeding in the Indian subcontinent is much higher. So we recommend breastfeeding, unless and until it's an affluent family who is insisting on not breastfeeding at all. What we recommend is either you breastfeed or you give totally top feed, don't mix feeds.
Okay, the most common cause that we're dealing with for the people living with HIV in Ludhiana mainly, and in fact we can say the whole Punjab, is first of all the IV drug abusers, number one. Number two are the truck drivers. And the third goes to commercial sex workers. So these are the top three causes of people who are getting HIV infections. So in order to prevent, we have to work at very grassroots level for de-addiction centers. We have to strengthen our de-addiction centers and create as much awareness as we can and health education on why addiction is bad. So people who are addicted to the drugs, they don't have any comprehension or contemplation of things that is how it is going to affect their lives in future. So IV drug abuse has to be stopped, and there has to be strict rules and preventive strategies designed by the government so that it can be stopped.
Yes, they can have sexual intercourse, but it is advisable to use a barrier contraceptive methods so that there is no further spread of body fluids.
I think there's no point getting scared or afraid because of the diagnosis of HIV. Even if you're diagnosed with HIV, there's a lot of chances that you might survive. It's not like olden times where you don't have treatment protocols and you can't manage the patient. I think it's very important to come at the right time to seek treatment, to know about taking medications and being compliant to the medications which has been prescribed. And if you're taking your medications properly and following up with the concerned doctor, I think your lives will be saved and you can go on with your life as normal people. So the more we spread awareness about HIV, the more it is better for the society itself.
The most important thing which a mother should do is to start antiretroviral therapy. That is the drugs which act against HIV virus. So as soon as she starts, the rate of transmission decreases from 30 to 40% to 2%. So initiation of ART, antiretroviral therapy.
Community level, the AIDS control program has so many, under the NACO guidelines, we have so many home visits along with just having ART center here at district hospital. So we have an ART center in CMC as well, that is works in collaboration with the district hospital. So we have trackers, we have the SOCH app, SOCH portal under which we enter the data of all the patients. So through that app, we are able to track out all those patients who are lost to follow up or who have left area and all. So we have a good competency of going through the fields and getting the patients back to the hospital.
The development of a child entire entirely depends upon the nutrition received in the intrauterine period and then the nutrition the child gets when he comes inside the world. So if you compare a child who is HIV positive versus a child who is not HIV positive, if both of them are given good nutrition, both of them will thrive equally well. Only children who actually have active HIV disease or they develop full-blown AIDS, these are the ones who will probably have malnutrition. Otherwise, HIV per se does not cause malnutrition.
Ma'am, when an infant is born with HIV, will he be a HIV positive throughout the life?
Okay. Now, if a child is born to a HIV positive mother, as I said earlier, you first need to be sure that the baby is HIV positive rather than having a test which gives you the passively acquired HIV virus or the antibody. So it's only by the age of 1.5 years or so that we are able to know if the child is actually HIV positive or not. Also nowadays the antiretroviral drugs for management of HIV are so good that people now consider HIV as something treatable. So somebody who is just HIV positive and does not have AIDS, that is the autoimmune deficiency state, you can expect the child to revert if treated in time. So there are protocols in place for how to monitor a child who is HIV positive, to look at the CD4 counts, and if treatment is started early and it is effective, hopefully a child can recover.
Thank you, ma'am. Thank you so much for spending your time with us. And the
Thank you so
information
much.
is really helpful. Thank you.
Thank you for taking the initiative.
Thank you so much.
Generally, if a baby is born from a mother who has HIV and has acquired HIV from the mother, the baby is not going to display any symptoms. So in the first few years, generally babies don't have any symptoms, so we need to have a high index of suspicion. We generally perform routine investigations to detect HIV, and the most reliable test would be done when the child is 1.5 years old, because the tests which are done earlier can have false positivity because of transmission of the virus and the antibodies from the mother to the baby. So the challenge would be if a lab is not able to give us the reports in time, or if we erroneously interpret a positive report as positive for a baby without giving consideration to the fact that there is passive transmission. So I think the challenge would be, for me, I say I'm lucky, I'm sitting in CMC Ludhiana. We have a very reliable lab and we get, our turnout times are also very shorter. But for a general pediatrician in the community, I think the challenge would be having a reliable lab they can trust on. And if somebody erroneously takes a positive report as positive, that would be a challenge for the child. That's what I think.
There's a misconception about the
Very, very, very important. Sometimes we have patients who come at late stage and they have not started ART before and they come in labor. So if we see the transmission rate, that mother to child transmission, the chances of having the child the HIV status, so it increases. If the mother starts ART early in the pregnant state, then what happens? The viral load is decreased, the CD4 count is normal, which is the count which helps in fighting the immunity. So it leads to low transmission from mother to child. India is a developing country. So in India, we practice that the cesarean section should be reserved only for OBS indication. But if we see the chances of spread, yes, the chances of spread from vaginal delivery is slightly higher than cesarean section. And if the viral load is more than 1000 copies, usually we prefer that elective cesarean section should be done. But it is according to foreign guidelines, not Indian guidelines. In India, we prefer vaginal delivery and cesarean only for OBS indications.